Morning. Welcome to another session under the short course in clinical epidemiology. Thank you for all the virtual participants as well for having joined and for your enthusiasm. So today we'll be having a new topic, which will be in qualitative studies. So I'm thankful to Dr. Reba who will be presenting this. This is on a spider framework, which is a new framework. So she'll be discussing about search strategies using FICOT format. You would have all known about FICOT statement. Some of you have presented seminars as well under FICOT. So this will be a slightly different one for qualitative studies. So without further delay, I'll hand over to Dr. Reba, and we are looking forward to it. Thank you.
Good morning, everyone. For today's CE session, I'll be presenting upon the spider tool for qualitative evidence synthesis. So the outline is as follows. I'll give you a brief background and we will come to the spider tool per se and how to apply it. So take a look at this question. Does CPAP prevent atrial fibrillation in patients with obstructive sleep apnea? If you want to find the answer to the question, you'll probably look at case reports, case series, case control studies, cohort studies, or RCTs. But we all know that the gold standard for reviews is actually systematic review and meta-analysis. Why? That's because it helps us to combine as well as examine individual effects of many studies, and it puts together a final effect. Now take a look at this question. What are the experiences of a patient with obstructive sleep apnea using a CPAP? What kind of a question is this? This is actually a qualitative question. So try to find out the experiences of a patient. Now, how do you go and find the answer to this? You'll probably conduct interviews with patients suffering from OSA, or you'll probably conduct focus group discussions, or maybe your observations from the water cells. We can look at case studies or narrative analysis. So qualitative research, it basically gives us an in-depth understanding into human behavior, emotion, attitudes, and experiences. That's why nowadays a lot of importance in healthcare is being given to qualitative studies. Beyond the famous Indian fable, there's an elephant and a lot of blindfolded people. They all touch different parts of the elephant, and each of them have their own perspective on what they're touching. But suppose if each of them had communicated with each other, they would have come to the conclusion that what they're touching is actually the elephant. So it's very important that even though multiple qualitative studies can be done separately, it's very important that we're able to synthesize the information so that we come towards a whole truth. In quantitative studies, that's called meta-analysis. In qualitative studies, meta-synthesis. So what's the use of doing these meta-synthesis? Basically, puts together data from various different healthcare it can generate new theoretical or conceptual models. And we can also use it to identify existing research gaps. And so it helps us to plan for new qualitative or quantitative studies. Very important for us to develop, useful for developing, implementing, and evaluating various health interventions. So if you look at this word map, these are the various words which we use when we talk about synthesizing qualitative data. So few of them are systematic review, meta-ethnography, meta-synthesis, thematic synthesis, meta-narrative, grounded theory, critical interpretative theory. All the words seem very confusing, and there are actually a plethora of various methods which we can use to conduct qualitative synthesis. Basically, we use these various methods depending on what you're doing the study for. You want to generate a new theory, or you want to find common themes, that's called thematic synthesis, or do you want to find differences in the various studies, that's called heuristic analysis. So based on what you want to do, you can choose any of these various methods. But overall, they come under the umbrella term called qualitative evidence synthesis. So are there any guidelines for reporting qualitative evidence synthesis? So there is this NTREC guideline which helps us to report the way the researchers conduct the synthesis. I just want to show that there are 5 domains. Out of it, we'll be concentrating today on the literature search and selection. So all this backdrop I have given basically highlight the importance of a search strategy. So without the there is absolutely no benefit of doing a qualitative synthesis. Your confidence in the search is absolutely vital to your search. Now, what are the strategies that we know? Commonly, but can you really apply FICOT for a qualitative study? There are a lot of limitations. So first of all, the P and I in a FICOT framework stands for patient, population of problem, or intervention or exposure. If you use these two and put search, you'll get a lot of quantitative studies, you get a lot of irrelevant data. You're only wanting qualitative studies, but if you press only these two, you get a lot of extra qualitative studies also. Second thing, there is no comparison really in a qualitative study. You don't have any comparison group. Suppose I want to find experiences of a patient with multiple sclerosis. What is the control? There is no control. So this is very redundant when you're searching for a qualitative study. And third thing is, you're actually trying to adapt your search question to fit into the PICOT framework, which is actually just a subjective exercise. It's not really beneficial if you want to search for studies. So are there any alternative search strategies? So they have developed a couple of other search strategies like SPICE and Eclipse and CIMO, but there are some limitations of each. So SPICE was actually developed for in the US for librarian, evidence-based librarianship. So S was standing for setting, P is for perspective, I is for intervention, C for comparison, E is for evaluation. For example, if you ask interns, what kind of shift do they prefer? Do they prefer shift system or do they prefer alternate day on call? Do they feel like they're learning, which is better for them in terms of learning? So setting would be the medicine board. P will be the perspective from an intern. I will be doing shift system. C will be probably doing alternate day on call. And you're asking them the perspective. Learning would be your evaluations. Eclipse is another tool which was actually developed in terms for health management topics. So E would stand for expectation, C for client group, L is for the location, I is for the impact, P is for professionals and service. For example, if you want to increase access to Wi-Fi in the hospital, that would be your expectation. Your client group would be patients and families. Location would be hospitals. I would be whether the impact would be whether the patients have easy access to Wi-Fi. Professionals would be the IT department or the health professional administration team. Service will be the provision of free Wi-Fi. But as you can see that these two are very limited. They're all actually designed for a specific user group and you can't really apply them to the general qualitative search. That is why three authors, that is Cook, Smith and Booth in 2012, they had come together with the SPIDER tool. So it basically helps clinicians or the researcher to brainstorm good search term strategies so that we can retrieve good data for our synthesis. So how was the SPIDER tool constructed? So basically they've taken the existing PICOT and they have modified it to adapt to a qualitative study. So the P population problem they have replaced with S for samples. So why did they do that? In a qualitative study, you want your findings of your study to actually be extrapolated to the entire population. But you don't need that in a qualitative study. So basically looking at a subset of population and understanding their experiences. So they have replaced that with a smaller term called sample. The next thing is intervention or exposure. So in qualitative study, you're not looking at intervention. You're basically looking at why a patient behaves in a certain way, why do they do those decisions, what is the individual experience. So actually they have replaced that with phenomenon of interest. So that stands for P and I. Third thing is comparison. So they have completely removed the term comparison and replaced it with D for design. So design of the study. So that was how design. Outcome they have replaced with the term evaluation. So that's almost same. And the last thing is they have added art. Okay, so after they constructed this tool, they wanted to study its effectiveness. So does it really work? So they had a search question and they did a systematic literature search using the PICOT and they also used the SPIDER tool independently. And they looked at the number of written articles as well as so what question did they search for? Experiences of attending an unfamiliar education. And the databases they searched were in CINAHL, Medline, and MBase. So CINAHL is mostly a nursing database. So before we move on, for people who are unfamiliar with literature search, we use basically three Boolean operators, that is and, or not. So for example, if I want to study, do a study on depression and anxiety, if I put depression and anxiety on the search box, I will get articles which are exclusive, which have both the names. So it will be more specific. But if I use the search term or, that is depression or anxiety, I'll get a whole lot of articles. It should just have either depression written on it or anxiety. Suppose I use not, depression, not anxiety, it will exclude all the articles which have anxiety, which deal with anxiety. So which search term will give you the maximum number of articles? Or which one will give you the least number of articles? And so when I put depression and anxiety, I got 178 articles. When you put depression or anxiety, you get almost 8 lakh. If you put depression, not anxiety, you get somewhere intermediate, around 4.9. So in this study, so they have used the same things. So using the PyCode, and they also use the spider tool. So using the PyCode, they have generated these search terms. So for population, they looked at parents basically. So they've used words like young, teen, parent, mother, or father. And they have put or in each of them so that you get a lot of, you basically don't miss out the spectrum. Next thing, they have used I. I is your intervention, that is giving antenatal classes. So other terms would be antenatal, prenatal, pregnancy, birth, class, educational workshop. C, obviously you can't use it. O is for outcomes. So basically, use what are the experiences, opinions, attitude, perception, belief, feelings, knowledge, understanding. When you use an asterisk, it indicates truncation. And this is the final search term. So they put P and I and O to search. Using the spider tool, for sample, they have used the same thing. Young, teen, parent, mother, or father. Phenomenon of interest would be your antenatal classes. The design is how did they connect the methodology? Was it questionnaires? Was it survey? Was it interview? Was it focus group? Was it case study? Was it observation? And E was further views, experiences, opinion. And R is basically was a qualitative study and was the mixed method. So they have taken sample and phenomenon of interest at hand, and they combine that with D, E, and R. Okay, so D or E, that means this or this. And they combine and with that R. So this is how they did the search strategy. So these are the final outcomes. So they have given the results searching in each of those databases. So using the PyCode, they got 953 articles. But when the reviewers, they did a proper title and an abstract review to look for relevance, they found they could use only 11 of those articles. So only 1% of articles they could include. But after they did a full text review, they found only 3 of them were useful for their study. But on the other hand, Spider totally gave only how many articles? Very few, 176. Out of it, 5% based on your title and abstract search, and 2 after a full text review. So overall, Spider gives you less number of articles, but the relevance is a little bit more as compared to the PyCode. So similar to others, Embase and Medline also, they have put their findings. So when they combine all the relevant articles from all the various databases, for their question, they found only 5 articles were useful. Out of it, both PyCo and Spider picked up 2 articles. PyCo alone picked up 2 articles. Spider alone picked up 1 extra article. And the relevance of PyCo was 0.1% and Spider was 1%. And this, the reviewers, they felt that the Spider search was easier because they were able to generate search terms because the terminology actually fitted in with their questionnaire. And it was easier to manage because the number of hits were less. So it's easier to do a review of all the relevant articles. But on the other hand, if you see, out of the 5 relevant articles, Spider only picked up 3, whereas PyCode picked up 4. Why did this happen? Because when we did that search tool, right? So we put and R. That means every title which had qualitative only was picked up. So if you, in your title and abstract, if the authors of the paper had not written that it was a qualitative search, that article was excluded using the Spider tool. So as a searcher, when you want to retrieve articles, it actually depends on how the authors have, whether their title and abstract had clarity. It also depends on the people who indexed it in the database. Have they understood and have they given the appropriate index? So problems with qualitative studies is because, first of all, there is poor indexing, and there's a lot of problems with the keywords which are actually describing the articles, and sometimes the abstracts are very unstructured. So that's the existing problems right now with qualitative study. So how can we rectify this? So what they're saying is, As in the first one, you use S and I together, S and PI together. That will improve your specificity. And instead of using B or E and R, just make it B or E or R. Then you will probably get more hits. So now let's use the spider tool and let's try to retrieve some articles. So recently we had a qualitative discussion in one of our CEUs, perspective of patient relatives in ICU. So for the sample, I have used patient relative or family or caregiver. Sometimes family are called informal caregivers. So I didn't want to miss that term, so I've added caregiver. Phenomenon of interest would be ICU care. My design would be either focus group, interview, or observations. E is for experience or perspectives. R would be for qualitative study. So when I searched it, so I have yellow basically stands for your S. So patient relative or family or caregiver. I have added it with ICU or intensive care. And again added it with qualitative, that's your R. And I've added the experience and perspective, which would be your E, along with the design group. So I have got almost 6,575 students. And if you look at some of the kind of articles you get, delirium-related distress in the ICU, a qualitative meta-synthesis of patients and family perspective and experiences. Then preventing chronic emotional distress and strokes awareness under informal caregivers, bonding in neonatal ICUs, experiences of extremely preterm infant mothers. Some of these articles really seem relevant to your question. Now I've used FICO. There, patient relative or family or caregivers are P, ICU or intensive care is your I, and your O is your outcome, that is your experience. Using it, now we have gotten 17,453, almost triple the number of articles. But if you look at it, some of them seem to be irrelevant. Suddenly there is a RCT. We don't really want RCTs in our studies. One more RCT. So as you can see that overall spider is more specific if you're looking for a qualitative study as compared to FICO, where you get a lot of irrelevant hits.
Yes. That's spider. So you had suggested a modification to their initial thing. So did you use the modified version of the spider or an ant, or did you use the original spider?
I used the original. The only problem is when you modify it, you'll end up with a lot of again you'll end up because qualitative will become more.
The modified version of being qualified, qualitative or experience, or could have got more studies.
It'll almost come to the original FICO.
That I'm doing both and seeing.
They had mentioned over there that because again, so they're saying basically what you want to do. Sometimes in qualitative research, you don't want it to be too extensive. You're not actually capturing everything like quantitative study. You basically, if you want to direct a theory, you need to saturate to your interpretation. So that, if you want to do an aggregative study, that is, you want to look at every single study in that topic, then you can use the OR.
Final perspective to be a scoping kind of review, right? Like you know the systematic review versus scoping review. The systematic review means we from the entire database, 1, 2, or 3 database. We are very possible and aggregate everything. But limiting this, does it make it into a realm of scoping review, or does it still part of the systematic qualitative review?
It'll be more of a scoping then.
Expand even further, intensive, critical, critique, by class. All the other studies mentioned that study more, I think because people are not putting that in the numbers. A qualitative study on the title.
Now I think they're starting to use that when you submit an abstract, you have to sort of mention what kind of method, but we can't do anything about all the previous studies which have already been published to date.
Questions from online participants.
For the
people learning here. What you mentioned, getting everything, in search librarians call it sensitive strategy. Where you don't miss any important article. So then you get a lot of junk. You may get lots of articles if you don't want, but you'll not miss anything. As opposed to a specific search strategy where you get only what you want, nothing is irrelevant, but you might have missed some articles which are of relevance. So ultimately, you have to balance what you want. So in some diagnostic tests, we say sensitivity is slightly different. But in search strategy, you have to have your mind clear. Do you want a sensitive strategy? Like suppose it's a rare question. Then if you put in Pico, you make it only 2 or 3 articles. You say, oh, my study question is too specific. Let me broaden it out and get some more articles. Let me be more sensitive. On the other hand, you're doing a qualitative study and you get 10,000 abstracts. Then your question was search strategy is too sensitive. Let me make it more specific and narrow down. So you have to have some balance between sensitivity and specificity.
And it's difficult to say sensitivity in
Please.
the denominator will be all the relevant articles. That means you have to literally handpick every single article and see if it's relevant. You can only cover it with whatever the correct.
There are no online questions. Maybe give a round of applause to you.